Good afternoon, and thank you for joining Kensington Senior Living for Brain Health as You Age, New Year, New Tools for Cognitive Wellness with our presenter, Dr. William Mansbach. I am Alexandra Ramsey, Director of Sales and Marketing for the Kensington Reston, an assisted living and memory care community located in Reston, Virginia. Kensington Senior Living also provides two additional communities in the DC metro area, the Kensington Falls Church in Falls Church, Virginia, and Kensington Park in Kensington, Maryland. On behalf of the Kensington Reston and our sister communities, we are delighted to welcome you all this afternoon. You are viewing this presentation in the Zoom webinar format. If you are unfamiliar with this format, your cameras are off and microphones are muted. If you have registered for this event, you will receive a copy of this presentation via your registration email to share with friends and family, or simply to view again. Kensington Senior Living is pleased to partner with organizations such as CounterPoint Health Services that work to change the face of behavioral health care. CounterPoint is committed to leading in evidence-based interprofessional behavioral health and memory care services in skilled nursing facilities, senior living communities, outpatient services, and community telehealth. CounterPoint is led by President and CEO, Dr. William Mansbach, who we are excited to have as today's presenter. Without further ado, I present Dr. William Mansbach.
Well, thank you. It's great to be with you. Just a couple of housekeeping issues before we get started. First, let's try to mute phones as best we can. Second, if you have questions, go ahead and put them in the chat. We'll try to do most of the Q&A toward the end of the presentation today. If there's something that's urgent that you really need me to respond to, I will. With that in mind, this is a presentation for you. We're going to talk about brain health, maintaining and improving your brain health as you age. I have to say that as a memory expert, perhaps the question that I'm asked the most is it inevitable that as we age, we will go into significant cognitive decline? What can we do that's evidence-based to protect our brains as we age? So I'm coming to you with both a clinical background and a research background. As Alex has said, I'm the CEO of CounterPoint Health Services. We provide psychiatric, neuropsychiatric, and memory care to adults and mostly older adults in senior living, in nursing homes, in the community, in lots of different clinical and residential settings. I also am the director of the BCAT Research Center, where we're really focused on trying to understand both the best ways of identifying cognitive issues as they emerge, but secondly, trying to be preventive so we can mitigate risk for illnesses like Alzheimer's disease. And I'm going to talk about that today. So my goal is to share with you actionable information that you can use to protect your brain as you age. See me as a resource. So I'd like to answer any questions that you have. You might want to jot down some questions now, just to make sure that when you leave here, you get the kind of information that you really are looking for. So what I'm going to do is I'm going to share my screen now, and I'll get feedback from the team if for some reason you can't see it. So I'm assuming that you can see my screen, and I'm going to go ahead and progress. So I'm going to start with common misconceptions about dementia risk. Quite often, we are asked questions about, as I said, the inevitability of illnesses like Alzheimer's disease, but we're also presented with a number of different, questions, feedback that people have regarding, does it make sense to have a particular diet? Is it okay to drink white wine or red wine, at night? Things of that sort. So I'm going to talk about four misconceptions that happen probably more than anything else. So let me just begin by doing that now. So the first question or misconception could be phrased like this: oh, it's all genetic. There's nothing I can do to prevent or lower my risk for Alzheimer's disease or dementia. That is, there's a sense of inevitability. Now, let me just take a step back for a moment. My co-authors and I wrote this book, Brain Health as You Age, specifically because we wanted to move the conversation about the emergence of dementia from a medical pathology model to a wellness model, giving people a sense of hope that there are things that they can do to reduce their risk. And there are things that can be done. It's just important that we identify what they are. This idea that it's inevitable because I have a genetic risk is problematic and not true. So what I'd like to do is talk about a few features of this, if I could. The first is to be clear with you that the term dementia and Alzheimer's disease are not interchangeable. In fact, if we really think about it, dementia is a collection of symptoms. You already know the hallmark symptom of any kind of dementia, and that would be memory decline. And of course, there are other indications of dementia too. But all dementia is the result of a disease. It is caused by something else. Maybe 60 to 65% of all people who have dementia have it because they have an illness called Alzheimer's disease. Maybe another 10 to 15% of those who have dementia have it because it's caused by strokes or what we call CVAs. There are other causes, other diseases that you will be familiar with. So in addition to Alzheimer's disease, vascular dementia, frontotemporal dementia, Lewy bodies dementia, there are basically 11 or 12 primary dementias. What's also important to note is that dementia, if it's truly an accurate diagnosis, is not reversible. So it's important that we do everything we can to prevent it from occurring, slow down the onset. If the average age of Alzheimer's disease symptoms begin to emerge at age 75, what if we can push that to 80 or 85? That would really be a tremendous win in some ways. And that's a lot of what we're talking about here, how to do those kinds of things. So dementia and Alzheimer's disease are not interchangeable. Dementia is the result of Alzheimer's disease or other related causes. Also, dementia caused by Alzheimer's disease is really confusing, isn't it? Because there are different variants or subtypes of Alzheimer's disease. So it's not always the same. So we use this word monolithic, that Alzheimer's disease isn't monolithic. It can be expressed in different ways. It can progress at different ways. You know, there are people who go from mild stage dementia to advanced stage dementia in a matter of a couple of years. Other people where it takes about, 15 or 20 years. So one Alzheimer's disease is not the same as another. Now, in terms of the genetics, this is how we started with this misconception. There is not one specific gene that always causes Alzheimer's disease. And in fact, you can have genetic markers, certain genes that are associated with Alzheimer's risk, but that doesn't mean that Alzheimer's will develop. So the gene that you may have heard of is called APOE. We've actually known about this gene for probably 25 or 30 years. At a more specific level, there are different types of APOE. We understand them fairly well, but what we don't understand, to be perfectly honest, is why is it that someone who has this gene, this marker, develops Alzheimer's disease and other people don't? So having the marker does not mean that you will develop it. What's very important to understand is that lifestyle changes or lifestyle habits have a lot to do with whether or not someone is going to progress into an illness like Alzheimer's disease. So misconception number one, it's all genetic. It isn't. There are other things, environmental issues, lifestyle issues that are really important, and we can control some of those. And I'll get to that a little bit later. The second misconception it goes something like this: online brain training, and you've seen them before from, there's just a zillion seemingly of marketed online brain training programs, Lumosity and others, for example. So the misconception is that these online brain training and brain games lower risk. So this may surprise you, it may not. the scientific evidence supporting most of them, not all of them, but most of them is really weak. It would be fair to say that the claims for the effectiveness of these brain games far exceeds the true empirical or scientific evidence for them. Now, you shouldn't be discouraged. It doesn't mean that none of them work. It just means that most of them don't work very well. You could choose some exercises, particularly those that are focused on what are called working memory. And I'm going to give you some. I'm going to give you some resources that you can think about. Working memory exercises that are validated by science. It isn't that they will always prevent Alzheimer's disease, but there's pretty good track record that they will delay onset and slow down actual progression. So I'm going to get to that in a moment and the other things that you can do with it. So, but you have to be very careful. You have to be a very skilled consumer, because I would say at least 90% of what's out there is really not very effective. These exercises that do work, you'll notice that they are at least moderately difficult to do. You have to make your brain work, and they're progressively challenging. They have to be done frequently, and our science at our research center would indicate a minimum of 3 times a week, but ideally 5 times a week. And by the way, you only have to spend about 15 or 20 minutes per session in doing them if you're doing the right ones in the right way. They also need to be novel. And what I mean by novel is they have to be things that you don't normally do. So invariably, I'm giving a talk somewhere, and someone will come up to me either after the talk or raise their hand during the talk and say, well, I have a very demanding job. I have to do a lot of problem solving. Will that help me? And my response generally is, it may help you, but that's not what I mean. That's not novel. You do those types of things all the time. Novel would be, and this is a silly example, but novel would be writing with your left hand if you're right-handed. I'm not suggesting that you do that. I'm just trying to suggest that that's an example of something that is that is novel. Moderately difficult and progressively challenging means that you are, in a sense, forcing brain cells, what we call neurons, to reconnect in certain unique ways to support and strengthen a certain cognitive task. You may know that most people with normal cognition have between 80 and 100 billion neurons. That's a lot of neurons. And they're very purposed. So you have millions and millions of neurons that are part of the memory system, and you have neurons that are part of the language system and so forth. So one way of strengthening your brain as you age by doing the right kinds of cognitive exercises is that you're forcing these neurons to communicate, to chain together in important ways. And that's called neuroplasticity. Probably heard that term before, neuroplasticity. So the caution about brain training is they don't all work, most of them don't, but some do. Choose those that are validated by science, those that focus on something called working memory. They should be hard to do for you, and they should be progressively difficult. They should be frequent and, of course, novel. So the third misconception I'd like to talk about is that if you do this daily brain training, that is the single most important way of lowering dementia risk. Well, it is an important way. But is it the best way to lower dementia risk? And actually, it isn't the best way. The right, and I say this in quotations, the right cognitive exercises can certainly lower your risk, but they can't do it alone. Sure, neuroplasticity is wonderful. It builds cognitive reserve. It can help support your brain, keep your memory intact longer. All those things are really good. But there have to be other things too. And I'm going to talk about an approach that we really push at CounterPoint and at our research center. And it's just referred to pretty generally as the Brain Health 5 activities. 5 activities that I'd really like you to think about doing very routinely every week to strengthen your brain health. And we talk about these in our book, Brain Health as You Age, among many other things. There's more than 5 activities we talk about in the book, but certainly these 5 really jump out. So they're going to be really, really important for you to focus on. So first thing I'm going to say, I'm just going to check a question. Okay, so there is a question here. I'm going to take a stab at responding to it, but most of the time I'm going to respond to questions toward the end. Question is, what's your opinion on the controversy regarding? I'm not really sure what it is, but I'm going to take a stab here, and I'm going to talk about the fact that there is a controversy about whether or not any of these cognitive exercises work. And I'll just say that actually at Stanford several years ago, there was a consortium of neuroscientists who got together and they looked at the entire literature of brain health. And what they found was that, actually what I'm saying to you, very few of these exercises actually work. The claims of success far outreached the actual efficacy or effectiveness of these exercises, but there are some that indeed do work. If there's a second part of that question, or if I didn't quite address it in the way that you want, I can certainly address that, and I will certainly do so. Okay. So the Brain Health 5, you have your cognitive exercises, and as we will see later, those are mostly about working memory exercises. Physical exercise, and I'll explain why that's important. Adequate sleep, proper diet, adequate social engagement. Clearly, there are more than just these 5. But if you look at the literature, the research literature, you find that these 5 are most associated with mitigating risk for dementia, but also building positive cognitive functioning. So it's not just about lowering risk for dementia, it's also about functioning in a better way, even currently. By physical exercising, if you really think about this, this is just the whole connection of the cardiovascular system and its relationship to general and specific cardiovascular health. And what I mean by cardiovascular health is making sure that those vessels that innervate and make the brain function appropriately are clear, are not plaqued, are basically efficient at carrying oxygen throughout the brain. Physical exercise is a great way of doing that. The evidence is really clear that out of all the BH5 exercises that we can do, you should start with physical exercises. Once again, you don't have to do this in a heroic way, minimum of 3 times a week. 5 times a week is better, and it doesn't really have to be more than 30 minutes at a time. And I'm going to come back to that in a little while later. Third, I'd like to talk about sleep if I could. So we understood brain health and sleep even better through the COVID-19 pandemic, which may sound strange, but we were doing a series of studies nationally at our research center, the BCAT Research Center, looking at stress experienced by healthcare providers and everyday people, right? One of the things that we learned, there's a measure, an instrument, it's sort of a stress temperature called the Mood-5 or the M5. It's free, and actually we make it available on a website on enrichvisits.com. You can take it whenever you want. But one of the things that we found symptomatically through COVID-19, people reported disruption in sleep more than they had with other pandemics and other unusual sort of psychological, experiences, problems, and things of that sort. So how does this relate to brain health? Well, it relates to brain health in this way. As we sleep, you're aware that we progress through a pattern of certain sleep stages. And when we get to deep or what's called slow wave sleep, our brains do something very different. And one of the things that they do is we clear, that's where our housekeeping is done, we clear certain protein toxins that are naturally occurring substances in the brain. One of them is beta amyloid. That's probably familiar to some of you because the accumulation of beta amyloid is associated with Alzheimer's disease. So one of the hypotheses that we and other groups have really thought about and tried to research is if people chronically are poor sleepers, or if people minimize their sleep and they get less slow wave sleep, are they at greater risk for cognitive decline because of the buildup of beta amyloid? And there's a fair amount of evidence that would suggest that that's actually the case. So I think sleep, which we used to think was always important, is now elevated to one of the most important sort of activities that we can do. So if you're self-prescribing, getting adequate sleep is important. What does adequate sleep really mean? Well, there are people who say, I do well with 4 hours, or I have 5 hours. Some people say they need 11 hours, but generally most adults and older adults need 7 to 8 hours of sleep. But there is an adage or a rule that we have that we apply to particularly stressful situations: flooding in California, pandemic, having a parent who has Alzheimer's disease and you're the primary caregiver. And it's basically N+1. We say that if you're used to getting 7 hours of sleep, you really have to focus on trying to get 8, even if it isn't all at the same time. So it's also important to think about what gets in the way of sleep. Late night eating, for example, maybe exercising too late in the day, caffeine, things of that sort. But targeting adequate sleep is really important. Proper diet's important. We at our center recommend the MIND diet. We talk about this in the book Brain Health as You Age quite a bit. We think that the research on diet and risk for brain health and for dementia risk is pretty clear. So the MIND diet, as you may know, really integrates a heart healthy diet, primarily that, with a Mediterranean diet, hence the MIND diet. And there are a number of things on it that are beginning to evolve a bit in our understanding, but I think that some pattern of clarity is really emerging. One of the questions that we get, which was quite controversial, was this idea that came from the MIND diet that a glass of red wine, because of the resveratrol compound in it, was actually recommended. It turns out that certain fruits, have these compounds that are quite helpful because they are buffering to the brain, which is nice. But I think the most important thing about MIND diets are, in addition, it would be thinking about leafy green vegetables. And in the subtraction world, it would be staying away from high fats that aren't positive fats that you would get in fish, certain fishes, and in nuts and things of that sort. So proper diet's important. The fifth exercise, or the fifth activity, I should say, that we would think is really important for mitigating risk is adequate social engagement, which may change from person to person. There are a number of people on this webinar, and for some of you, talking to 10 people a week is too much, is a lot. For others, it's barely enough. So it's really adequate in an individual sort of way. But there's something that happens in social engagement, what we often refer to as meaningful engagement, that you can measure at a neurophysiological level. You can look at certain things like oxytocin and other hormones that are released and are generally only released under two circumstances: spending time with friends and spending time with pets. So there have been some interesting studies looking at hormonal levels in older adults with and without dementia who spend time with dogs. Kind of interesting. It doesn't have to be just dogs, it's just more science in that way. Associated with better health, not only better cognitive health, but better mood health as well. Okay, so let me move on a little bit to the fourth misconception. So this one's is a little complicated, but you could summarize it in this way: memory medications are my best chance for lowering dementia risk. So for any of you who have tried what are called nootropics or memory enhancers, nootropic is basically a broad category, not just medications, but could be herbal remedies and things of that sort used for lowering, not really lowering dementia risk so much, but improving memory. Medications like Aricept, for example, is probably the most commonly prescribed nootropic or memory enhancer. So this misconception is that, hey, memory medications are my best chance for lowering dementia risk. And I wish I could say that that's the case, but the evidence is overwhelming that that is not the case. So I don't want to alarm anyone on the call here. So I'm not saying that you definitely should not be on them. What I'm saying is that there are other things that you should be considering. And just to share with you, I'm not anti-medication. I'm a person who really believes that you use tools that work. If you have a UTI, a urinary tract infection, you should probably be on an antibiotic, but not any antibiotic, just one that's sensitive to, right, the bacterium that you have growing in your urinary tract. So I can say quite declaratively, as of right now, in January of 2023, these medications are not, as a class, very effective and can have side effects. And particularly in illnesses like Alzheimer's disease, once you're in, for most people anyway, through years 1 and 2 and maybe 3, there's almost no evidence that these medications are effective. I could describe for you, if we have time, I'll save it for the end in case somebody really wants to know about it, why they can't work. Because there's clearly a reason in terms of the neurophysiology of the brain, why they are really limited at this point. Now, that's on the negative end. On the quite positive end is that the non-medications, these activities, these BH5 activities we're talking about, head to head are more likely effective at reducing risk and improving brain health. And that's really clear. So the right kinds of cognitive exercises, physical exercise, sleep, the right kind of diet, social and meaningful engagement. These are the types of things that actually are non-pharmacologic, have no side effects, promote sleep, are socially positive, and are more effective at reducing risk for illnesses like Alzheimer's disease. Okay, so we started with these misconceptions. So let's talk a little bit more specifically about how to improve brain health and lower risk. Like, okay, well, what really can I do about this? And so most of what I'm going to say to you is totally free. Some of it maybe isn't, but most of it is. The idea here is to take advantage of tools and programs that already have good science. And so I'm going to talk about 6 of them right now. Some I've already referred to, but I'll go into a little bit more detail for some of them. First thing I'll talk about is the Enrich Calculator. Enrich Calculator. You can get that by just going to, it's free. You can just go on a website, www.enrichvisits.com. This is a consumer-facing website. It's created by the BCAT Research Center. They have their own website for providers who use BCAT tests and things of that sort, which are used very widely in the United States and in other countries. The idea of the Enrich Calculator is based on these on 6 specific behaviors that lower risk. And what you can do is you can see how you're doing in terms of risk at any time by taking the calculator. So it's pretty simple that way. I'm going to go into more detail on working memory exercises. I may say a little bit more about the mind diet. We've talked a lot about sleep. I've already talked about beta amyloid and other proteins that are just cleared normally under slow wave sleep and why that's really important, physical exercise and social engagement. So let me just go first to the Enrich Calculator. If you go to the website, it looks like this, and you can go ahead and get started. And what happens is you're going to get a snapshot and a report. You can go to your email, you can go to your iPhone, whatever device you're basically using. And we're going to talk about these 6 brain healthy behaviors, and they're pretty simple, right? They're pretty simple. But I want to kind of look under the hood of it. So we talked about physical exercising. And so, how intense should exercising really be? we're asked questions about, well, should it be cardiovascular exercise? What about weight training and all of that? And what I want to say is, for all these exercises, you don't need to go to a gym. You don't need to buy expensive equipment or anything of that sort. Things like brisk or power walking can cover about 85% of the necessary cardiovascular load that you would get if you were running or you're going to a gym or going to a gym class. Now, I'm not discouraging you from doing all those things. That's great to do them, but you don't have to do them. Smoking, my guess is that most of the people on this call, at least statistically, that would be the case, are not smokers. And that's a good thing, because smoking pretty much ruins cardiovascular health. There's a clear risk factor. In fact, maybe I'll associate the risk factors to each of these activities to the development of Alzheimer's disease by age 80. Maybe that's one way of thinking about it. So people who are chronic smokers and people who have been smoking for at least 10 years and inclusive of their 60s have about a 9x or a 9-time likelihood, enhanced risk of developing an illness like Alzheimer's disease. Now, I'm also going to say that some amazing things happen on the recovery if you stop smoking. So smoking cessation is really important. We can actually demonstrate for you what happens to the brain after the first year of not smoking anymore, even if you smoke for 50 years. We can describe to you what happens in year 3, in year 5, in year 10. So the idea is that if someone's smoking, if you are somebody else, and you have the idea that, well, it's too late, I've been smoking my whole life, it's actually not too late in most cases. So I would certainly encourage you to give that up. The cognitive exercises, working memory, I'm going to get to that in a moment. I want to talk about mood. So one of the items on the Enrich Calculator is this question of depression. So people who have chronic depression, doesn't mean depression all the time, but depressive episodes, at least 5 in the course of an adult life, without treatment. This is the key thing, without treatment. Treatment being defined by pretty rigidly as a medication or a talking therapy, have about a 4 to 5x enhanced probability of developing dementia. And you may be wondering why that is. There's a complicated answer and a simpler answer for our purposes today. And the simpler answer is it's really all about the stress hormone cortisol. When we get depressed, and the same thing can be said for persistent anxiety, we release a stress hormone called cortisol. In the short run, that's really important. In the long run, it becomes destructive. It destroys a neurotransmitter that we need to feel happy called serotonin. And it eventually degrades something called the hippocampus in the brain, in the limbic system, which is responsible largely, but not entirely, responsible for the ability to make new memories. So if you get depressed, it's okay, but get treatment. For some reason, treatment has a lot to do with lowering cortisol levels. Actually, it's probably not so hard to understand. What about blood pressure? This is part of that cardiovascular health thing. We look at systolic, that higher number. So if you take the calculator, it's going to ask you what it is or what it was the last time you saw your doctor, and you put it right in you can do it right from your phone right now if you want, and it will give you an idea of risk in terms of that. And the last thing is weight, and weight is really about your mass body index, and it's sort of a general way of thinking about weight. And this isn't about this is about healthy weight. So I'm not talking about people who are a bit overweight, really talking about reducing the risk of obesity for one primary reason. I'm sure it's important for your cardiovascular health, and that has an impact on dementia. But it's really about type 2 diabetes. Type 2 diabetes will, if you have type 2 diabetes and you're in your 50s, and your risk for developing Alzheimer's disease goes up pretty dramatically. not all is disaster though, because if you're sitting here and you're listening to this and you have type 2 diabetes, just keep your blood sugars in the right range. Because when they get too high and sometimes too low, that's a problem. And weight is associated with the development of type 2 diabetes. That's kind of what that really means. Okay. So I keep referring to working memory exercises. So this is one of our books called the Working Memory Exercise book. If you want to get it, go ahead. You can get it on Amazon or at our bookstore or at other places as well. So I want to talk about working memory exercises for just a moment. Because I keep saying, well, you have to do the right kinds of exercises. And you don't have to use our book, use other books if you want, as long as they have good science behind it. So what is working memory? So I'd like you to be able to, when you leave this webinar, know what this means. So working memory is simply the brain's ability to pay attention, to focus attention long enough to learn something new, to do some cognitive task. For example, if I said, can you memorize this phone number? You would need working memory. You'd have to focus on it and you'd have to do something. Now, to put it in context, most of us have a limit to our working memory. We can only pay attention and make something happen for 30 seconds at a time. And what I mean by that is that if I ask you to do something, and if you listen to what I ask you to do, and then you don't try to do it for more than 30 seconds, you won't be able to do it. And so I'm going to give you a little sort of illustration of that. So we're not all in the room together, we're in a virtual room together, but I want you all to try something with me, okay? So what I'm going to do is I'm going to give you a telephone number and I want you to memorize it. And I want you to memorize it without writing it down. And so it'll take me 10 seconds to do it. And you might be able to do it because it's within that 30-second category. So if I said, here's the phone number, and when I'm done, say it back to me, I want to see if you can do it. And most people can do it. So let's try it. Here's the phone number. It is 410-878-6154. Now, what's the number? So I can't really hear you, but I'm going to pretend that you were able to do that. And the reason why you should be able to do that is that you started saying it back to me within the 30 seconds that you have. Now I'm going to do it differently. Now I'm going to give you another phone number, but before you say it back to me, you have to start with the number 100, count backwards by 3, and then tell me the number. So that would take you out of your 30-second window of concentration. So we're going to do that, and I want you to see what the difference is, okay? Because that's how working memory exists. So here's my number, 202-516-9118. You'd say 100, 97, 94, do it with me, 91, are you doing it? 88, 85, 82, 79, we'll stop there. So, and now I can say, what's the phone number? And it's a lot harder to do. Okay, so as we age, our working memory efficiency gets less. That's normal. That's a normal aging. And with illnesses like Alzheimer's disease, our working memory decline accelerates. So these exercises are designed to keep our working memory efficient. And if working memory is efficient in everyday life, we're better at remembering things, we're better at remembering people's names, we're better at all kinds of tasks. And that's why working memory is so important, and it protects our brain as we age. So that's the working memory part. Okay, I'm going to talk about some key resources here, and then we're going to do some Q&A. Okay, so first thing is, If you haven't done it while we're talking, maybe you can do it when we're done. Go to the Enrich Visits website. As I said, it's free and easy to use. There are a number of resources there. So there's something called the Enrich Calculator, which I just described. If you have concerns about your cognition or you have concerns about someone else's cognition, you can take a scientifically validated cognitive self-assessment. It's not a test. It's not like a BCAT test. It is simply a screening tool that will indicate, should you have a conversation with your doctor, your healthcare provider about possible memory issues. It's called My Mem Check. And we created this at our center because there really wasn't a good self-assessment that was in the industry. And we did it because we knew, and the science demonstrates, that there is on average a 2 to 4 year gap between when people notice memory issues and when they actually talk to a healthcare provider. And that's too long to wait. So we created My Mem Check for anyone to use at any time. It's used a lot in primary care. And one of the advantages of My Mem Check is that you can do it privately at home, but you can get a report. And if you want to email that report to a family member or to a physician or whatever, you can do that. So that's important. Another resource, and I referred to this earlier, is called the Mood 5, the M5. If you are feeling particularly stressed for whatever that reason may be, the M5 is a really good tool to take. If you have elevated high M5 scores of 6 or higher, that's just a value. And it's okay if you don't remember it, because you can just go right to the website. For 90 days or longer, your risk of depression is pretty high. So that's important to know. The 15 for Me program, I'm just going to mention in a moment, that's important. The CBS 8, and I'm just reading from the header that we have here, that's really for people who have dementia and may have related dementia behaviors. There's a bookstore of resources. A person can get a BCAT test by a professional virtually if they want, and then there's some other information. Okay, I am also going to suggest that you sign up. It's free. Information is not shared anywhere, but there is an Enrich membership. And what's good about this is you'll just simply get emails of new things about memory and often about mood. So this is based on the science for the most part. You can always, if you don't find it helpful, you can always disaffiliate. That's not a problem. One of the things that comes out every week is like a cognitive teaser exercise. Teaser only because we want people to do it, but it's just something to keep your brain active. So all it requires is a name and an email address. And as I said, the information does not go anywhere, but it's something that you can do if you'd like to. We mentioned the Brain Health as You Age book. 3 of us were approached by the publisher to try to create a book that people could just use without a lot of scientific jargon, but based on science. So that's the Brain Health as You Age. You can get it anywhere. You can get it on Amazon if you want. Seems like everything's on Amazon. You're going to hear more and more about this new program. Just talked about it a second ago, called 15 for Me. It is a way of spending only 15 minutes a day to reduce stress, but improve brain health. And it's based on what are called the 3 C's of stress reduction: specific cardio exercises, cognitive exercises, and centered breathing exercises, which are really meditation oriented. We're excited about this program because the science is great. So it's just beginning to be available for people now. It's available for organizations, but I just want you to kind of keep that in the back of your mind as a potential resource for you. This is just a little bit about the menu on 15 for Me. It's a lot of fun. It's a great way of improving brain health, lowering stress, spending very little time doing it, which is nice. So it's more doable, but people really enjoy it. And I will say that the first studies, which were national studies, showed that 80 to 90% of the people who did it reported significant reductions in their stress after 4 weeks. So that was pretty exciting. Okay, so what I'm going to do is I'm going to stop my sharing, and I'm going to look at questions that are here. And I'll go ahead and take them. And I'm going to start with the bottom and work up. And we'll do it this way. Okay, could you show the slide again of where you can send an email to sign up for Enrich? Well, I'll make it easy for you. If you go into just Google enrichvisits.com, look at the bottom of any page and you can sign up that way. So that should be pretty simple. There's another question. Is there still general agreement that beta amyloid buildup is the cause of Alzheimer's, or are there other theories emerging? This is a great question. There is general agreement, but a fair amount of disagreement. There are two proteins that are involved probably in Alzheimer's disease, beta amyloid being one, the other one being tau, T-A-U, which tau is probably more an issue within the neuron, beta amyloid probably outside of the neuron. But the problem with the whole toxic protein, these are both protein hypothesis, is that we have no idea why these naturally occurring substances just hang around in the brain for certain people. So I'm not so sure. I mean, I think one reason why all these clinical trials on medications haven't worked is because they focus on really the wrong thing, to be honest. It's not about beta amyloid. It's about, well, why do substances like beta amyloid stick around? Why do they not naturally clear, I think, in the first place? So we have a way to go. Just an anecdote. A few years ago, the Alzheimer's International Association meetings were held in Washington, D.C., and I was invited with two other memory experts to talk about this idea. At the time, it was, how do we cure Alzheimer's disease? And so two of the people there do biological research. We do more applied research. And they talked about, where we are with beta amyloid, and science really wasn't very impressive. And so when it was my turn, and by the way, the group, these were congressional folks. So these were mostly contingent of House representatives and senators, part of this Alzheimer's coalition. So my thinking was, actually what we have to focus on is less on beta amyloid and tau, and from a curative way, but we should really be trying to delay onset. If we can delay onset by 5 or 10 years, prevalence of Alzheimer's disease is going to go down remarkably, and I still really believe that. Okay, another question. Our dog was diagnosed with type 1 diabetes 6 months ago. What do studies show regarding dogs developing conditions similar to dementia or Alzheimer's disease? This is an interesting question. Thank you for posing it. So Alzheimer's disease is statistically a human illness. You have to have a mammalian brain. Dogs have a mammalian brain. So there may be a variant that is related to the canines. There are studies that have showed that there is a buildup of some substances like beta amyloid in dogs. The weird thing, though, is that, and it happens with people too, you can have a buildup of beta amyloid and not be symptomatic, or you can have barely a buildup and be symptomatic. So it's not a one-to-one correlation. So it is sort of interesting. There is little evidence that dogs with diabetes develop Alzheimer's disease. So you don't have to worry about, I think, that part of it. So I hope that I was able to answer your question. Another person talked about being 90 years old, sometimes struggling to think of a name or a book title, but 10 minutes later it pops into my head. Is this typical? It's so typical. Let me just say that by the time you're 50, you're all in a room, I'd ask how many people are 50. This slip of the tongue, I can't remember, particularly when we're stressed or we're preoccupied or depressed or whatever, this is normal aging. This is not an indication of Alzheimer's disease or anything like that. So if you come up with it later, and even if you don't, that's different than someone saying, do you remember, 10 minutes ago, we talked about the dog and you had no memory of that. That would be more of a concern. So this is just normal neuronal inefficiency. That's really what it's called. And that's just kind of a problem, that can happen. Okay, so let's see. Next, a panel of outside experts advised the FDA against approval, saying so. This is this new Alzheimer's drug, one of two new Alzheimer's drugs. That the ability to decrease plaques hasn't really translated, shown an impact on sort of clinical progression. So I have a very strong view on this, and I just want to say it's just my view. Other people have other views. So there is near zero evidence that this medication, that any of the medications, but the newer ones in particular, that there is a clinical difference. It's so minor, it's statistically not significant or barely so, and I think really not statistically if you look at the science carefully. The problem is there are side effects that are quite serious. And I don't want people to have unrealistic hope that they go on a medication that's going to make them better. The other thing that's happening here is that if you're a Medicare beneficiary, your premiums are going to go up, payments to payers are going to go down, and CMS has already said the reason for that is to pay for the cost of these new drugs. And if they're not effective, and it's negatively impacting a greater number of people than the people who are going to be benefited from it, that might be an issue. So stay tuned. I'm really hoping that these medications get better. And I was there for this original presentation of this phase 3 trial that failed. And so it was quite interesting that somehow it got turned around. Okay, I think we're starting to get toward the end of our questions. I'm going to see if there are any other ones here that I may have missed. Oh, I guess so. So more have been added here. Here is one. Let's see. Do you handle memory and cognitive communication therapy for TBI rehab for survivors with severe frontal lobe damage? At CounterPoint, we certainly treat and have treated a number of people with TBI issues. It's really complicated. So we have something, it's a division within CounterPoint called Brain Health and Psychiatry Center, the Brain Health and Psychiatry Center. We see a lot of people, second opinions, I would say, people who have had a lot of issues, sort of unclear diagnostically what's wrong with them. We do a lot of coaching. We do a lot of cognitive coaching and brain health coaching. It's been pretty effective. We actually measure success. I think that's really important when you offer this for other people. So maybe kind of offline, I can respond to that question a little bit better. There is a medication question, and I'll respond to it with the caution of I'm not evaluating a particular person. I can only talk in general terms, and it's about Namenda. So Namenda is a memory enhancer. It was approved originally by the FDA. It was actually the first one for moderate stage dementia. Most of these medications are approved for mild stage dementia. It's only now that people are kind of going for the whole enchilada, mild, moderate, and severe. So if a person's taking it twice a day, is it advisable to stop, see if there's any difference in cognition? Well, I don't really know. I would approach it in this way. You wouldn't want to rapidly stop any medication unless it's a dangerous medication or you're having a dangerous reaction to a medication. The body gets used to a medication, and it's kind of a systemic issue. So that would be important. But also, it's important to know using something like a BCAT test or something, or a functional test to see, are there really changes? Medications like Namenda are less effective for cognition and a little bit more effective for function. So it goes like this. You can be on Namenda and you probably aren't going to remember to take your medication any more than you would prior to Namenda, but maybe you remember how to get to the dining room. That's kind of the idea in some ways. I am quite supportive of people going off memory enhancers if they have a really low BCAT test score, because I know that they're not getting any benefit from it, and they could be having side effects, nightmares, GI distress as being the number one, problem, things of that sort. You just have to go off it really carefully, and with the help of someone else. Okay, what is your opinion on PET scans as a general diagnostic tool? My opinion is they shouldn't be used as a general diagnostic tool. They're expensive, very specific, and they're things that should be done first. Neuropsych testing, MRI, not a CT scan, not helpful. But PET scans can be very effective, depending on whether or not we have some sort of treatment options. So if people have advanced dementia, I think that they're irrelevant because we don't have a lot of medications for that. Although we have some non-pharmacologic medications, behavioral management medications, you don't need a PET scan for that. If someone's in early stages, or maybe were you trying to figure out if they have Alzheimer's disease, then it might be a good thing to basically do. PET scans are an amazing technology. I'll say that. That's really important. Which reminds me that just one thing about MRIs, it's not really your question, but often an older adult's going to have a change in mental status that's very rapid. It could be caused by a urinary tract infection or pneumonia or a problem with a medication, but it also could be the result of something vascular. And an MRI can be really effective under those circumstances, but a PET scan would not be the sort of the scan, the imaging device of choice. Let's see. Okay, so last question. I think it's the last question because I know we're running out of time here. I think this is about diabetic medication, Metformin. What about research that has shown Metformin can help with memory function? I'm not convinced that it helps at all with memory function. I think that there are other things that are going on when you get blood sugars under control that naturally result in improvement in cognition. I guess one more. 4 years ago, my aunt was diagnosed with mild Alzheimer's disease and put on meds for it. I'm assuming memory enhancers. Now my aunt's neurologist said she does not have it. That's interesting. They sent her for a 5-hour cognitive memory test this week. How accurate are those tests? It depends on what they are. So if you do things like BCAT, a battery or something like that, they're highly sensitive, about 96% sensitive to identifying Alzheimer's disease or dementia. It's pretty high. I imagine that this Cog Evaluation was done by a geriatric neuropsychologist, and if that's the case, probably it will be quite effective. So just one of the values of neuropsych testing is that before you put somebody on a medication, if you do the testing and it's the right kind of testing, it would tell you whether or not you should be on it. I can't tell you how many people, because they are depressed or because they had a UTI or some sort of infection, presented as if they had Alzheimer's disease and were treated accordingly. And of course they didn't. They had some other medical problem. So it is important to check that out. Okay, so I think we're going to have to bring this to a close. I hope it was helpful. I hope you had as much fun as I did. And any questions that you have that I didn't get to address, I think there were at least 18 questions. That's a lot. I'm happy to try to answer them via email online. So I'm going to turn it over to the Kensington staff. Just thank you again for having me and look forward to talking with you again.